Hello, everybody. I'd like to thank you all for tuning into Living One Day Older, a LinkedIn live broadcast happening every Saturday at noon Eastern Standard Time for my global friends. It'll be a little bit later for you, with the goal to provide us all, me included, a roadmap for those of us who are looking out into a new frontier I call growing forward with time. Some grow older, but most of us simply wish to grow forward. If you or anyone has a business whose products and or services relate to a 45 plus year younger audience who are living one day older and choosing to grow forward with time, hit me up on LinkedIn Messenger. And if anyone out there would like to sponsor a LinkedIn Live broadcast with me, you too can find me there. Right now, we're going to find my dog who is scratching at the door. It's the best to let them in, if you know what I mean. So yeah, you can find me on Living One Day Older on Facebook page and or on Instagram. Living One Day Older on both of those. So without further ado, allow me to introduce Dr. Beth Phillips, who I had met through the K2 medical research firm where I had registered myself for a memory study to find out where my genetic disposition was headed as I'm growing forward with time in my life. So let's say hello to Dr. Beth. Hello.
Good morning.
Good morning. So, my fellow Orlandian, we are in a very wet city beautiful. That's Orlando's nickname, the city beautiful. And how you doing today?
I'm good. I'm just trying to stay dry.
I know. And I'm going to let you know, speaking of beautiful, I chose to let my hair down today because normally I keep it up. But I was attempting to match your gorgeous, beautiful mane. So I'm going to that compliment to you right now.
Thank you.
Beyond that, let's get back to business. All right. So why don't you introduce yourself through your career, as I'm sure also our veterans out there would like to know that you're part of the story there has some really great footprints you've left behind. And I was wondering, and I'll shut up after this, but, if that's how you found yourself previously in the emergency medicine field that you were in. So I don't know, so many questions. So just please take it away.
So yeah, I'm Beth Phillips. I'm a native of Alabama. I have lived quite a lot of places, but I've moved to Orlando right at almost 4 years ago. With my spouse's career, brought us down here.
Yeah.
I have almost 30 years, close to 30 years of emergency medicine experience. I went to undergraduate at the University of the South in Tennessee, went back down to Alabama in Birmingham for medical school. And then I served in the Navy for several years. They sponsored a medical school for me. So I did a year of internal medicine with them and then 4 years out in the fleet on 2 different ships, did multiple deployments and got to do a lot of interesting things at that point. And then got off active duty, but was remained in the reserves, but did my residency in emergency medicine in Baton Rouge, Louisiana. After that, moved different places, doing different jobs in emergency medicine. And about almost 2 years ago, decided to take a segue into clinical research. And that's what I've been doing full time, although I'm still in the ER. Some point of every month, I'm still clinically practicing that. But my full time is now in clinical research with K2 Medical Research here in Orlando.
We hadn't spoken about it, but my family is all involved in the medical field as well. We've got doctors and nurses and emergency room nurses and EMTs all up and down both sides of my family. So we have that connection as well.
Yeah.
And, speaking of my family, the reason I had myself decided to go for this memory study was because my mom, God rest her soul, she passed away this past May 2023. She had dementia, and we understood that her dementia was more created by a sedentary lifestyle, from plaque building up in her brain. And so a reminder to everybody: move. Move your bodies, move. I know some of the bodies hurt more than others, but moving at your pace is really essential. But so I actually have another family member who also has dementia. And again, I realized that their dementia is caused by actually Lyme's disease. And it just, even though with those two, I knew where their where theirs was, where theirs came from. I have found at the young age of 59 that I am, I have certain issues with memory, and I think mine, since I've done the study and I've gotten some good news back, I think, well, it was, and that's how you and I met. I think mine has to do with, I don't know, maybe some habits in my earlier brain development years, like in teenagers when I wasn't really behaving as well as I am now with, I was exploring things, and still a good kid all in all, but it's just God, those teen years, my gosh. And I've got two teens right now, so I kind of buckling down with them. But anyway, segueing here. But I feel like mine is, I've got ADHD, and we're constantly thinking like many steps ahead of the now, and with that, we're not focused on, often not focused on what's in front of us. And so I'm gonna forget someone's name because I'm too busy worrying about well, whatever it is I'm worried, not worried, but just my mind is constantly busy, right? So,
Right.
but that's why I did study. Okay, I'm getting back to because my memory was starting to get a little wanky, and I saw K2 medical research had offered in my area, a study, and I went in to your offices, and they were really, everybody was so professional, and the offices were so sharp, and it was close to me. I like that. It was nearby. So, and on top of that, I got paid. I was like, wow, I got paid for this. But what was exciting is I didn't only get paid for it, but I got some really rich information based on that study. And I wanted to address with you, first of all, if, addressing the myths behind the stigma of medical research and some of the fears that may keep some of us from taking steps to join the medical field, who help find advancements in various fields of study, and how we may reconsider our hesitations. So can you touch on that?
Sure. Well, first of all, I'm glad to hear that your experience coming into our clinic was good. We pride ourselves on being very approachable, and we want to be there as a resource for people in the community, for education, as well as a bridge in the medical care continuum. So I'm glad that went well for you. Clinical or medical research in general, is an area that is just fraught with frightful possibilities and horror stories over the history of medicine. And I think even here in 2024, we still struggle against some of those very negative ideas that come of medical research based on some of the horrific ethical violations that happened previously. And most everyone in clinical research now, and certainly K2, I could say for K2, that is first and foremost in our mind, is that everyone that participates in research understands what the purpose of this research is, that it's 100% voluntary, and that this is all intended to be helpful not only for the individual, but for future generations. That sometimes the research benefit doesn't necessarily benefit the individual receiving the current study, but what we learned from that helps our children and our children's children.
Right.
So that's a big important part for me.
Yeah.
And then, but we do look at it as a bridge. There's a lot of things that are coming out and available, and we'll just focus on the Alzheimer's because that's the study you came in for. It was an Alzheimer's specific study. And there are a lot of things that are being developed, researched, looked at, and it is not available in clinical practice now. We do know that there's 2 medications that have now been approved, but it's still not commonplace, and doctors are not comfortable with it, and it's not being commonly prescribed right now. But there are so many things in the pipeline that are being looked at, and patients don't have access to it because their primary care doctors don't have access to it yet. So what we can do is, particularly in this particular disease realm, where there's not an option, we'll put aside the 2 new drugs right now, but there's not really another effective proven treatment option right now. You're given this diagnosis, or you suspect this diagnosis in yourself, and you're left with, well, what the heck do I do about it? I mean, so not only do you have all this fear of what's coming, what's going to happen down the road, but I can't do anything to help myself. And so clinical research is a venue where a patient can be proactive and at least feel like they're taking some proximal control of this disease. And we have options to allow people to receive care that they can't get otherwise. It's at no expense to the patient. And that's a big thing. This is not something that's going to bankrupt a patient, much like unlike
insulin
and trials that are out there in clinical practice. Just your insurance doesn't cover it, but here's the treatment. You pay your $35,000 a year for one drug if you can. That's not the case here. And we want to make it available to everyone who is, an appropriate candidate for the study. And that's part of my job there, is to assess who is safe to participate in the study, who does it benefit, would it not benefit somebody to participate in the study, and if so, what would be other options I could recommend to them?
Well, when you called me with my results, which is the first time we met, because I had met with your team in the office, and yes, there's the medical aspect of it, but I really appreciated the personable, the kind. They just were really warm and personable with me, and maybe it was just a comfortable place to be. But you gave me. It wasn't even the sad news that I could not be in your study, because it was the good news for me. And, I wanted to share that with the audience here because it was fascinating information. I have a hard time remembering, like I said, hard time with my memory, but, remembering all of your medical terms. But, when you shared with me the ApoE
gene type, yes.
Which is the you educated me, even though I'm having a hard time remembering how to say that name. And it's only 4 letters. ApoE. It sounds very Native American to me. But the say it again.
ApoE. ApoE. Yes, the abbreviation.
ApoE. It was fascinating. There was ApoE, I think. This is what I'm asking, if you can go through it with me, because there was I thought I remember it being 2 and a 3 and a 4, and there was it has to come from both sides of the
you get a gene from each parent, and so you're a combination of what you get from your parents. So you could be a type 2 and a type 3, or 2 type 3s or whatever, but you get one from each parent.
Right. And mine was type 4. 3.
I think you were a 3-3.
If you can remember mine.
3-3,
which meant that, take it away, Dr. Beth. Don't
So
let me
the ApoE gene is a gene that's been identified to have some association with the risk of developing the amyloid pathology, which is basically the definition or a diagnostic tool to diagnose Alzheimer's disease. Alzheimer's disease has the presence of amyloid plaques in the brain. That's different than like the plaques you get in your heart arteries or on your teeth. It's different plaque. But these amyloid plaques form. And actually your test, the study you did, there was two things we talked about. One was a biomarker, a blood test that showed the presence of amyloid or elevation of the presence of amyloid. These blood biomarkers are actually new novel tools that we have that have come online fairly recently, again, due to clinical research and patients being willing to go through studies, where we can now identify just from a blood test, do you have elevated amyloid, which implies you have amyloid plaques or the higher probability of having amyloid plaques in your brain, i.e. Alzheimer's. And that's independent of whether you have no memory issues yet or not, or if you're already on that track. The second thing we looked at was the ApoE gene. And that gene, like I said, has been affiliated with risk factors of developing that amyloid pathology. And there's three types of the gene identified, ApoE2, ApoE3, and ApoE4. And ApoE3 is the most common version of the gene, and it is not associated with any increased risk above average. Average risk is anywhere from 5 to 15% of developing amyloid pathology throughout the course of your lifetime. The ApoE4 gene is less common, and it is actually associated with a higher risk of developing amyloid pathology, as well as some other risk factors. And then ApoE2 is a really rare gene, and it's actually associated with a lower risk of developing the pathology. So you get a copy of the gene from each parent. And so you're going to be a combination of the two gene types. In your case, for example, you were a 3-3. And I'm only saying that because you told me I can talk.
Yes, exactly.
So you're a 3-3, which means you're right there, and I called it the average bear pack. I mean, you're not at any higher risk of developing amyloid pathology or Alzheimer's than that 5 to 15% risk that we all carry just from being alive. So that was the good news for you. A, your amyloid was not elevated at this point in your life, and B, that risk factor of the gene type was in your favor. But the gene type is just another risk factor. It is a factor that you can't control. There's a lot of risk factors that are out there that are more controllable, and that's a part of that education and knowledge we want to give people when they come in asking for memory screens and whatnot. We have lunch and learns and other community events where we can go out and talk about brain health and offer pre-screening or memory screening so that people can start to understand there's a lot they don't know that they don't know yet. I mean, because this is not a big thing that we've pushed until the past few years of looking at your cognitive health, particularly in the lens of longevity. I mean, we're living longer and we want to live longer and healthier, and we want to be mentally competent for all of it. And that's not where medicine focus was for most of our young adult lives.
Yeah.
So sorry, I kind of segued from the gene talk, but there's other risk factors to consider too. And your diet, you mentioned exercise, staying active, social engagements, using your brain. There are a lot of things that you do have positive control over that kind of help protect that mental health throughout the years.
Well, I'm going to pipe in here, and when you mentioned keeping your brain active, there's a lot of memory games out there, a lot of apps and whatnot. But let me tell you something, folks. If you just got onto any of these computer, things are constantly changing in the computer, the internet and the computers, and they're always evolving, and like AI, AI could be, learning about these tools that are right in front of us that are useful is another way I believe that we can just keep our brains, active and learning the complexities that these tools can offer us. And then us figuring it out. Like, I know puzzles are good, and word games are good, and and reading books. Keep our brains, not just staring at screens.
Absolutely.
Yeah, that right. So, I am really grateful that you were able to come on and share this time with us. I don't know if, I've got David Buck on. He's close to us up the road, David Buck. David, I'm going to do a plug here. David also has an amazing LinkedIn audio. Yes, David. On Thursdays at noon, whereas mine are Saturdays at noon. So they don't compete with one another. And I would like to turn everyone towards David's program. I would like to also, thank you for coming on. It's a Saturday afternoon. You could have been anywhere, but you agreed because I wanted Dr. Beth to be my first guest, because my living one day older, or as you can see behind me, Lodo. Where is it? Lodo, which I love that I came up with that. And, it represents the road, towards the new frontier that we're all headed. And it's, growing forward with time. It's so much with aging speaks of against time. And really, we're all in the now. So we're with time, and I just feel like it's an adventure, a journey that we're on together. And when I was playing around with my network, and which is a network as well as a broadcast here on LinkedIn Live, when speaking with Dr. Beth, you had spoken about longevity, and you had brought up a terminology, and it was living one day older, or you spoke of one day older, and I was like, one day older, yeah. And then, and speaking of, how can I work with that? And then living one day older as we're growing forward with time, it just all fit for me. And I hope it resonates really well with those of you who I'm speaking, with and to in the 45 plus age group. So, I'd like to thank you for coming in and talking with us. I'm going to, in the comments, after we close our broadcast here, I'm going to put Dr. Beth's LinkedIn link inside the comments. So, if you have any questions, or you want to learn more about K2 medical research studies, you can contact her, message her. And, same with me. I want to encourage you all to tune in next week to share time with me and Dr. Elena, who's just received some really exciting news from her own tests that she's had done around her really revolutionary skincare line for maturing skin. Her line is called AB Bionovations. That's a mouthful for me. But again, if there's anyone out there who would like to, if there's something you'd like to promote about you and your business brand that relates to, living one day older, do you have a project or event to share? You have a new product line or pilot program to launch? Let's talk and see if living one day older and is a good fit for you and your business. I'd like to thank Dr. Beth. Thank you so very much for coming on. It's been great.
Thank you for having me.
Yeah, it's been wonderful. And we look forward to seeing you all next week, 12 noon Eastern Standard Time. And thanks again for tuning in. We appreciate you guys. Bye. Bye, Dr. Beth.
Bye.